I'm David Herdman. I'm a neuro and vestibular physiotherapist working in London. So we use lots of different sensory systems for our balance and orientation. So we use our inner ear balance, which senses movement of our head, but we also use our hearing, and we use our vision, so what we see, and we use the sense that comes from our muscles and joints, which tells us where our limbs are in space. So the brain integrates all of those different senses and helps us to stay upright and balanced and orientated. So really, a disruption in any of those different senses can lead to a sensation of dizziness or unsteadiness. So in essence, there's quite a lot of things that can cause dizziness, but a common cause of dizziness is a condition within the vestibular system, so the inner ear balance mechanisms, which has connections through the inner ear up to the lower part of the brain and into the upper parts of the brain as well, where dizziness is perceived. So demyelinating disease can affect those pathways and cause dizziness. But we also know that people with MS are particularly prone to a form of vertigo called BPPV, benign paroxysmal positional vertigo. And this causes symptoms of dizziness when they lay down in bed or roll over in bed or tip their head up, and these kind of positions that can provoke dizziness just for a short period of time. This is a mechanical problem of the inner ear and can get better with some specific treatments as well. So usually a physiotherapist would ask you quite a number of different questions to try to establish what are the different characteristics of the dizziness. So when it might come on, what kind of movements might trigger it and how long it would last. Then they would typically do an examination which involves looking at your eye movements and certain reflexes of your head and your eyes, as well as doing a specific test for positional vertigo where they lay you down on the plinth and see whether that reproduces your symptoms. And then they may also go on to look at your balance and your walking. And then after that, they'll be in a position to recognise whether some exercises might be able to help you or whether you might need some further investigations. So one of the interventions is called vestibular rehabilitation. Essentially, this is an exercise-based therapy which involves different eye and head and body movements. And the idea is to gradually desensitize the brain to the movements and the activities that might bring on dizziness. There are also some other specific treatments for other vestibular conditions as well, which involves specific maneuvers. But essentially, exercise is a key treatment for dizziness and balance problems. So essentially, vestibular rehabilitation works by bringing on dizziness a little bit so that the brain can put it right. So over time, the brain desensitizes to the kind of movements and environments that at one time may have provoked the dizziness in the first place. So generally we avoid medication, so usually it doesn't really work, and also taking medication over a long period of time can sometimes worsen the problem of unsteadiness and balance. Essentially, some medication that suppresses the vestibular system can actually delay recovery and affect the parts of the brain that we need to naturally recover. So usually we don't encourage long-term use of medication, although there are a few conditions where that can be helpful. So it's worth, if you're concerned about medication, speaking to your doctor. So yes, outside of traditional vestibular rehabilitation, think about any kind of exercise that involves head or full body rotation or movements. So that's why, for example, I think racket sports are a really good idea. Also, there is some evidence towards Tai Chi due to its focus on balance postures and those kind of things, but really any kind of exercise that you enjoy and you engage with, but be specific. So it's got to challenge your balance. It's got to be quite difficult in order for you to improve. So that's a good question, and the brainstem is a complex structure. So it depends on what part of the brainstem is affected and how that might manifest. So for example, there are some eye movement disorders that typically wouldn't respond to exercise. Nevertheless, in the largest study that's been completed to date, they looked at vestibular rehabilitation in people with MS, and they compared the results of people with brainstem lesions and without brainstem lesions, and they found similar levels of benefit from both of those treatment groups. So there was no significant difference. So that suggests that even patients with brainstem lesions might benefit from vestibular rehabilitation and physiotherapy to manage their dizziness problems. So I think the first one is seek the appropriate help and try to see a specialist with interest or knowledge of the vestibular system, and that can be a nurse or physiotherapist or sometimes audiologist as well. It's often a bit of a myth that dizziness is not treatable. In actual fact, the vast majority of causes of dizziness can be treated effectively with trained specialists. The second one would be try not to avoid those movements that bring on the dizziness. It's very natural and common that if something brings on dizziness, you're going to try to avoid it. But actually, bringing on that dizziness, even in the short term, if it makes you feel a little bit dizzy, can help the brain to recover and reduce the response to dizziness over time. And then the third thing is that exercise is safe. Even if it does bring on a little bit of dizziness, usually it is safe and actually is part of therapy. It's part of helping you to get better. But I think often people go full guns blazing and then they might need to rest up and for longer afterwards. So that kind of boom and bust cycle doesn't necessarily help. So when you're exercising, just start off gradually, starting off with something very simple and easy, and then gradually work up as you can tolerate more and more.